Active surveillance is a way in which we can follow patients with low-grade prostate cancer. It sounds crazy. You've got prostate cancer and we're not going to treat it. However, what we do know now is that there are several men, and a significant percentage of men, that actually have such a slow-growing prostate cancer that we don't need to be overly aggressive in the early phases. But don't be misled. We're not leaving you out forever. We follow you, and that's why it's called surveillance. We surveil you forever, basically, and the way that we do this is we do two things. Number one, we're going to follow the PSA. The PSA is helpful for us because as that PSA rises up, there is a higher potential that the cancer inside of the prostate is starting to grow. The second thing we do is repeat biopsies, which I know is the most favorite thing that patients love having done. Nonetheless, we want to make sure that we're actually following that cancer to make sure that we're not seeing a higher grade of that cancer or a higher volume of that cancer. If we see a higher grade or a higher volume of that cancer, at that point, we then change routes and pathways and recommend a more aggressive intervention for that. But this has come about because we know that these lower grade prostate cancers are actually growing very slowly. It originally started with men in their 70s, and now we find men of all ages that we're following very closely. As long as we continue to follow men with a low-grade prostate cancer with their PSAs, and routinely we'll get a PSA every 3 months, we'll see the patients back twice a year. At 6 months, routinely we'll do a rectal exam to make sure we're not seeing any changes on the rectal exam, on the physical exam, and then repeat a biopsy. So again, the biopsy is going to be done at years 1, years 3, and years 5, and then every 2 to 3 years thereafter. The biopsy, unfortunately for the patient, is the most important thing that we have that lets us know whether there is more cancer present or whether that cancer has started to grow. If we see that, at that point, we change avenues. And that avenue is then going to be an avenue where we say, we have seen a higher grade cancer, we see higher volume, we need to now consider treatment. The underlying goal on active surveillance is we don't want to overtreat, but we also don't want to undertreat. Because if we let a cancer continue to grow and it gets outside of the prostate and it gets beyond the confines of the prostate, now we're in trouble. So there's a fine line there, and we're going to be following this very, very closely to make sure that we don't miss that. There are always risks of this, but as long as we are following the PSA as well as the follow-up biopsies, the chances that we're going to be missing a high-grade or high-volume cancer that is going to get outside of the prostate is extremely low.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.